Jackson 16 WAPT News begins with breaking news.
Good afternoon, and thank you for being with us at our what once was a daily 2:30 press conference. We haven't been here for a couple of weeks, and so it is good to be back and give everyone an opportunity to talk about where we find ourselves. But before I do that, I do want to take a personal point of privilege and thank the people of Mississippi for all of your prayers, your encouragement, and your support. I believe in the power of prayer, and I can tell you with certainty that I felt your prayers. I can't tell you how many of you reached out to me on social media platforms, through text, through emails, to my main number, through phone calls to our office, and I can say with certainty it has made a difference, and I want to thank you from the bottom of my heart for all of those prayers and encouragement and support. I also want to take this opportunity on November the 24th of 2020 and wish my bride a happy anniversary. We were married 19 years ago today. Literally 15 months after our wedding day, I declared to be a candidate for public office, one of those things that we had not talked about before it just spontaneously occurred. But Ely is a fantastic First Lady. She's an even better mom and wife, and I'm proud to have her by my side through these challenging times. When we said for better or worse, I'm not sure that we contemplated that COVID-19 would occur, but she has been a rock for our family, and so happy anniversary, Ely. We're here today to talk about COVID-19. COVID-19 is not going away. It's not going to just disappear. In fact, across the country, it appears to be getting even worse. Mississippi has been able to avoid the national surge in cases for a while. We had seen 7 or 8 weeks of slow but steady but small increases in overall cases. However, now it's clear that we are in the middle of our second surge. If you look at our numbers, while we have not yet returned to the height of the pandemic, where we were in late July 26th, where we had 1,392 cases on a 7-day average. If you don't include today's number, which was a little bit lower than what we've seen on most Tuesdays dating back for the last 3 months, we have seen a 7-day average that has reached the level of just under 1,300 cases per day over a 7-day average. If you look at our hospitalizations, we are continuing to trend upward. Yet again, not where we were at the peak. If you look at both confirmed plus suspected cases, we peaked in August at around 1,250 cases. Today, we find ourselves, if you add those two numbers, at 1,040 cases hospitalized. If you look at ICU patients, we peaked at 337. Today, we have 224 patients in the ICU. If you look at ventilators, we peaked a little over 200 cases. Today, we have 107 on ventilators. But what we know is that hospitalizations tend to lag total number of cases. As we looked at this throughout this pandemic, somewhere between 15% of cases end up in the hospital. So as we've seen these large numbers over the last 10 days to 2 weeks, we know that our hospitalizations, even if the total number of cases were to flatten or hopefully decline, our hospitalizations will likely continue to rise over the next week to 2 weeks. And so we have to be careful, we have to be diligent, and we have to take action. As we have done since June, we continue to monitor the data and make decisions accordingly. Today, we have more counties that qualify for additional measures, including mask mandates in these individual counties. In total, there will be 19 added today. Alcorn, Attala, Bolivar, Chickasaw, Choctaw, Jeff Davis, Jones, Lafayette, Lawrence, Lincoln, Lowndes, Neshoba, Panola, Perry, Prentiss, Stone, Tippah County, Tishomingo County, and Union County will be added. You may recall several weeks ago, we initially started with 15 counties with additional restrictions. 2 weeks ago, we added 7. So with the addition of these 19 counties, we will now have 41 of our 82 counties under additional restrictions. To be fair, there are 4 of those original 22 counties that no longer technically meet the criteria. I have made the decision that we will leave those 4 on with these additional restrictions for at least another week. All of them, while they fell under our very objective criteria, fell under it by a relatively small margin. For instance, Lamar County, the largest of the 4, is now below 200 cases over the last 2 weeks, but they're somewhere around 194 or 195. And so it seems to me to make sense that even though they're slightly under the objective criteria, that at least for another week, we leave them on and see what happens. As we go into Thanksgiving, just 2 weeks from today, we have much to be thankful for. But we also have a duty and an obligation to be smart. This is a critical time. Please be extra cautious, and please look out for your loved ones. There is much more COVID-19 around us. There is much more in our communities, and therefore there is a greater risk that you may unknowingly pass the virus to someone that you love dearly. So I'm strongly encouraging my fellow Mississippians as we go into Thanksgiving, a day that we all look forward to spend with our family. And we all know that in 2020, as difficult as it's been with the isolations and the quarantines and staying away from anyone for 14 days here and there, how much we are all looking forward to seeing our family. The facts are that it is risky. I'm not going to stand up here and tell you you can't do it, because each Mississippian has to step up and make their own decisions. But I will tell you that the risk is greater today than it has been at any time since August. I will tell you with certainty that social gatherings in and around Halloween has helped contribute to where we find ourselves today. There is more virus in our state when we're seeing 7,000, 8,000, and 9,000 cases per week than there is when we're seeing 3,000 and 4,000 cases per week, as we saw 6 weeks ago. That means the risk is higher. The risk is greater. And I can tell you with certainty that there are many positive cases, some of which have been detected, some of which have not, in which the symptoms are not very much. And so because of that, it behooves all of us to be smart as we go into Thanksgiving. I did do a call yesterday with Secretary Azar and the leaders of HHS, and I just want to give you a very brief update that there is more positive news coming out regarding the vaccine. According to the data that we received yesterday, we all know that both Pfizer and Moderna's trials have reached a point at which they've made the results public. Both vaccines have an approximate 95% efficacy rate. It is believed that both vaccines are very safe. Now, they are currently will go through the CDC and FDA process. They will be peer reviewed to confirm that they are indeed safe. But assuming that occurs and that they receive emergency authorization, it is possible that in America we could receive up to 22.5 million doses of the Pfizer vaccine by the end of December and 15 million doses of the Moderna vaccine by the end of December. That's 37.5 million doses before the end of this calendar year. I want to just mention that, and Dr. Dobbs, correct me if I'm wrong, but my understanding is that both of these are going to be a multi-dose vaccine. It's going to require at least 2 shots to be fully vaccinated. And my impression from the call yesterday is that these 2 shots must take place about 3 weeks apart. And so even if we get the first round of vaccines in the middle of December, that doesn't mean that we can all go back to normal before Christmas. And so keep that in mind, as this is a multi-dose vaccine, and that it's going to require a little bit of time to get a large number of our fellow Mississippians with that particular medicine. The other thing I'll tell you, there's been a lot of conversation and discussion and maybe even some unwarranted criticism regarding the distribution of these vaccines. I want to assure the people of Mississippi that the distribution will be done appropriately. It will be done the right way. In fact, it will be done the way in which the Department of Health and I ask the federal government to distribute it. It is going to be a decision made by executive leadership at the state level as to what our priorities are. Dr. Dobbs and I have had multiple conversations about that, and we as a state are well on our way towards having a distribution plan in place. The other thing I'll tell you, the Pfizer vaccine is going to be distributed by Pfizer because it does require it being stored at extremely low temperatures. The Moderna vaccine will be distributed utilizing a contract that is already in existence between the CDC and McKesson. And just for those of you in Mississippi like myself who are pretty daggum proud to be a Mississippian, I want you to know that McKesson will distribute this vaccine out of 4 facilities in America, 2 in and around Louisville, Kentucky, and 2 in and around Olive Branch, Mississippi. And so over 1,000 of our fellow Mississippians will be involved and engaged in the distribution of the Moderna vaccine, and I have full confidence, just as they do with 80 million vaccines a year already distributed by the CDC, that this distribution process will be done fair. It will be done in such a way to get this out to the people of our state and our country as quickly as humanly possible. I know that I can't wait to have access to it, and I will be excited as soon as the trials are completed and the safety measures are in place and approved by the various agencies to take it as soon as is appropriate. Until that time comes, however, we have to bridge the gap. There is light at the end of the tunnel. There is a vaccine on the way. Because of Operation Warp Speed, this vaccine was developed in record time. It will be distributed in record time, but it's not going to be distributed tomorrow, and it certainly wasn't distributed yesterday. Therefore, our current position must be to bridge the gap from now to when that vaccine becomes readily available for the American people. As we move into Thanksgiving 2 days from today, please be safe. Please be smart. Wear a mask. Please do not take unnecessary risk. Look after your loved ones and keep them safe as well. This is a tough time. I know that people are tired of even hearing about the coronavirus. I particularly know you're tired of sacrificing and ready just to get back to life as normal. But we also know that God tells us that He does not give us more than we can handle. He called all of us to live in this time and to be a part of this mission. We all have a role to play. I know that we can, and I know that we will get through this together. At this time, I'm going to turn it over to Dr. Dobbs to give us an update.
Thank you very much, Governor. Today we're reporting 665 new cases and sadly a large number of deaths, 53 new deaths. I do need to let you know that that 665 is going to be an undercount for today. There have been some transmission lags from some of the hospital partners through the electronic lab reporting, so expect that number sadly to increase as well. Our total number of deaths stands at 140 cases stands at 144,544 and 3,729 deaths. Obviously, we've been severely impacted by this virus. If we look at our total excess deaths in the state of Mississippi since all this started, we have 5,090 more deaths than would have been predicted based on previous year's estimates. So clearly, we feel like this is an undercount of the number of deaths that we've had. And for perspective, this is about 18% more deaths than we would see on a normal year. So of all the deaths that we've had, we've increased almost by a fifth from the coronavirus, and that's only since really March and April, so it's not even a whole year. So it is a serious threat, and I want us to take it seriously as we go into this holiday. If we look at how different age groups are impacted, we've seen a lot of kids, and unfortunately we've seen a lot of cases among school kids and transmission in school environments, but we do know that kids and young adults get over it reasonably well. There are sadly some bad events, but by and large they recover quite nicely. But as we think about going into the Thanksgiving holiday, what about other age groups? If you're between the age of 50 and 64, our mortality rate has been 2.3%. 2.3% of those diagnosed with coronavirus have died in this age group. That is way, way higher than we ever can see with influenza. If we look at those between 65 and 69, 6% have died. Between 70 and 79, 10% have died. And between 80 and 89, 18%, and over 90, there's a 27% chance of dying from coronavirus of those who've been diagnosed with it. And the reason I bring this kind of up at this point is, as we're going into Thanksgiving, we're going to be mixing young folks who get over it by and large quite nicely with middle-aged folks like me and older folks who they love. And it's a really dangerous time for us to spread the coronavirus. It's extremely important for everyone to realize that you don't have to be feeling symptoms of coronavirus to spread it. Or we've seen multiple super spreader outbreaks where someone said, I just had a sinus infection, or this is just allergies, right? Not only do we need to be very cautious, but if you have any symptoms that could be coronavirus, you may have coronavirus, even if it's just nausea. We know some people have very limited symptoms. So as we go into this holiday season, want to really reinforce how important it is, the CDC guidance, right? We want to keep it small, want to keep it primarily within nuclear families and local. And I'll add, especially in Mississippi where the weather's not too bad, do it outdoors. It's much, much safer to have your social gatherings outdoors. So please keep it small. If we jump to the hospitalizations, the governor did go over the hospital numbers. Our counts have been rising, as he had mentioned. If we look at the Jackson area, we see that there is only one hospital that has ICU beds available still. We're feeling a lot of pressure on that front. And then in DeSoto County, where we know we've seen a lot of cases, there are 0 ICU beds in our Mississippi hospitals, at least in DeSoto County. On a happier side, if we look at the vaccines, we do have 3 vaccines that look very promising. We have Pfizer, the Moderna, and the AstraZeneca. Pfizer did submit emergency use authorization request to FDA, and we know that they have it on the schedule to be reviewed by their advisory committee on December 10th. And depending on how that goes, a vaccine may be available to us in small numbers in relatively short order following that. Additionally, we have some new therapeutics available to us. One of them is bamlanivimab, which is a monoclonal antibody by Eli Lilly. And we do have that product has been delivered to Mississippi, and 92 Mississippians have thus far received this product through their hospitals and health systems. We also anticipate getting more of this, but also Regeneron's antibody product that the president received will also be available in the near future. The only thing that I would like to just to close with is I do want to remind everyone how important it is if you are diagnosed with coronavirus, you have to isolate at home. There is a legally binding public health order that if you are contagious with coronavirus, you have to stay home away from work for 10 days, right? I think most of us know that. We did add to this last week that if you are the family member of somebody who has coronavirus, if you live in the same household, you need to quarantine. Now, quarantine is less restrictive than isolation. You can go to work under certain special circumstances, but you cannot go to social events, you can't go to parties, you can't go shopping. If you live in the household of somebody who has been diagnosed with coronavirus, you must quarantine. It's so very important if we want to turn this around, and this also is a public health order. But please go to our website if you need the details on the quarantine and what that entails. And Governor, that's all I have today. Thank you, sir.